do that now. And then after this session, I will be sharing the link to the recording as well as sharing the links to the resources that we go over in today's session. Okay. So today we want to give you a quick overview of the program, go over major requirements for the BA and the BS, show you some resources that help with course planning, and talk briefly about enrollment and the field experience. And then I hope to save a chunk of time to do the Q&A with our student panelists. So I know a lot of you probably have a lot of questions, and thank you for sharing some of those in the RSVP. If you have questions during the session, please just jot it down, hang on to it until the Q&A session, and we'll address those then. But before we kind of really get into the academic side, I want to share a few other ways to get involved and some upcoming events for things that we won't be able to cover as much in today's session. So the Global Health Program offers these quarterly conversations in global health. And so that's what's pictured here. This was last fall on asylum seeker health. The events bring together students, faculty, and then subject matter experts to talk about current global health issues. So this fall quarter, it will be Water Without Borders, Global Challenges and Local Solutions. And you'll be hearing from me once the date has been finalized for that. I also encourage you to get involved in our Global Health Student Orgs. So you'll be hearing more about those from our student panelists. And during the academic year, I send out weekly newsletters. I try to keep it useful, try not to overwhelm you with emails. So whenever there's like a new course or new pre-approved field experience opportunities, if there's a research opportunity, all of that is included in the newsletter. So please review those. I do also offer some workshops with Study Abroad. I'll be doing one in the fall also about field experience. So we'll talk about it today, but more to come on that too. And then, of course, whenever you have questions about anything, please come to advising. That's where I'll formally introduce myself. I'm Jane Eichhorst. I'm the Global Health Program Undergrad Advisor. And so the best ways to get in touch with me are either through the new Triton Advising, and I know I've communicated with some of you through there. That system, once you're enrolled, will become the Virtual Advising Center, or the VAC is what you'll hear it referred to as. And you'll have access to the VAC throughout your whole time at UC San Diego. This is where you can message any advisor on campus. So it's the best way to reach out if you have a question about a degree audit or a prerequisite, or when a course will be offered or how it will be applied. But then for appointments, I would say to email the GHP advising at ucsd.edu, email to schedule an appointment with me. I have my appointment calendar here. It's also available on the website. But don't be scared that I have just appointments listed and not drop-in advising. So I do have open appointments this Friday and all next week, the following week. So if you want to meet with me prior to your enrollment, please reach out. For the summer appointments for incoming students, I am focusing more on fall enrollment. And then I'd say if you want to do long-term planning or talk about study abroad, double majoring, all that exciting stuff, we would talk about that probably at a later appointment in fall or winter quarter. Right. And now I want to turn it over to Dr. Giselle Sanchez.
Hello, everyone. My name is Dr. Giselle Sanchez. I will be one of your instructors if you take some of my classes in the Global Health Program. This fall, I will actually be teaching the Global Health 148, Global Health and Cultural Diversity. as well as a special topics course on adolescent health. And you'll see that the rest of my courses are listed there for your convenience. And I actually received my PhD at UCSD. I went to undergrad at UCLA, and I both graduated in undergrad and graduate school in anthropology. So what I really want to emphasize about global health, Jane, if you could go to the next slide, is that global health really is interdisciplinary. Whatever field that you choose, whatever career path, whatever you're interested in, has a global health connection. So for those of you who are interested in health, of course, any health career has global health dimensions, ways of thinking about how people's well-being is influenced by broader structures, by broader cultural conceptions, by local policies. And so global health really is about emphasizing the health of people worldwide, but through this particular lens of health and equity for all. And so you'll notice that in the global health courses that you take, you will learn how forms of well-being and health really sometimes overlook the ways in which cultural conceptions, lived experiences, social structures actually determine a lot of health outcomes. And so in many of your classes, you'll learn how factors such as immigration, such as race, ethnicity, socioeconomic status, how all these kinds of intersecting domains play a role in the health of populations worldwide. And you'll see on the left side here of the slide that those of you who may be interested in law or in education and program management, that all of these are fields in which you can make a difference through a global health degree. And I would say that the biggest strength of this program is the fact that it really emphasizes a hands-on dimension. So this field requirement that you have, which Jane will address later on, but that you really get to learn a firsthand experience of the delivery of healthcare through any source that you either see on the website that's already available or not, but that you can really immerse yourself in forms of global health that will help you to see firsthand how you can make a difference, not just through the health sciences, but also through these other forms of intervention. And Jane, you can continue on that.
Sounds good. Thank you. So we'll start today with the major requirements. I did get quite a few questions about the BA versus the BS majors. Can you switch in between them? If you were admitted to the BS major, can you switch to the BA? The answer is yes. You will have to wait until the fall quarter to be able to do that through the new Triton student system, but you will be able to change your major between the two. You also, if you start out in one of the majors and later on decide that you do want to switch, you'll have the option to do that too. So what I would say is right now, if you are, let's say, a BS major planning to continue with the BA, plan your fall quarter as if you're a BA major, because you will be. You will be one. So then for the BA major requirements, for the lower division, students will take Global Health 20, an introductory core course, and then a lower division statistics course. So both the BA and the BS majors require lower division statistics. If you took AP stats and received a score of 3 or better on it, you can use that AP credit for your statistics major requirement. I note this because it is not something that will automatically happen. So just remember in your head, AP stats, and then to reach out to me later on if you're wanting to use that for your major requirements. Then for the upper division core courses, these are the same between the BA and the BS. So there's Global Health 148, 181, Management 173, and a Policy Analysis course. So the Global Health 20, 148, 181, and Management 173 are all offered every quarter during the academic year. And none of them have prerequisites. So they are manageable to fit into your schedule. Then you'll see all of the electives listed for the Global Health BA major. As Giselle mentioned, one of the best things about the Global Health program are all of the elective options and how interdisciplinary it is. So we'll be going over the website soon just to see how to pick your electives, but this is the listing of your different options. Also, as a note, all major courses must be taken for a letter grade of C- or better. And then on to the BS major requirements. So similar for the lower division core, but then you'll also have lower division STEM courses. So a year of general chemistry, a year of bio, 2 quarters of calculus. Typically students do the math 10A, 10B sequence, lower division stats. And then again, the same upper division core, and the electives are from the same categories as listed with the BA. So now I'm going to share my screen to show you some of the resources available for planning. And so I know the big question is, well, what do I take in my first quarter? And I wish that I had an answer of, this is exactly what all of you should take this quarter, but it's hard because you're all coming in with different AP credit, different transfer credit, have different career goals, and then you're split among 8 different colleges too. So I'm going to show you what I recommend using kind of for planning, especially in this first quarter. So if you haven't already checked out this resource, I recommend doing it. And again, I'll send you this link later on, hopefully tonight. So this is plans.ucsd.edu. And here you can select your college. So we'll just say we're a Revelle student. Because there are no major curriculum changes to global health, you can list the 25-26 plan. And then here you'll do global health program, and we'll say your BS major. So then this plan will list all of the major global health major requirements and all of your Revelle college requirements. So this is a great sample tool. It also, they give you the option as a transfer student, what it would potentially look like. So it's not going to be necessarily perfect if you're coming in with transfer credit or AP credit, but it gives you a good place to start, I think. The other point I want to, let's see, another path I want to show you, I suppose, is this modified plans for students coming in with or placed into different math. So if you're not placed into starting with Math 10A, that is fine. There's still a path for you. So that's what we have listed here. And again, I'll be sharing this too. So you can see the long-term plan with if you're starting in like Math 2 placement, and so on. So just, I hope that that helps to clarify kind of where you're at with the math. And if you have questions about math placement, you can always use the new Triton Advising to reach out to the math advisors directly, or reach out to me, and then I can try to connect you to the appropriate person. Okay. So now I want to share some more about the electives of global health. go. So from the Global Health website, if we go to major requirements, so this is what I was just reviewing on the slides earlier, the major requirements here. But down here is where the elective options are listed. So this is what I always direct students to when you're trying to decide what electives do you actually take to fulfill these requirements. So medical social science electives, BA students will take 3, the BS students will take 4. So you can see just how many options there are, right? Sometimes this gets to be overwhelming for students because they're like, well, how do I pick? And what do I, how do I know what's even being offered in a certain quarter? We also have a courses page, and on this page, I have listed what global health courses are being offered every quarter. So once the summer is done, I'll be updating with the spring 2027 schedule too. And every quarter, I also do a kind of course offerings page, like cheat sheet for you. So let's say you're coming in fall of 2026, BS major, you can see, okay, for the lower division of the course options, these are the courses that are actually being offered in the fall quarter. So this gets to be really helpful once you get to upper division courses and you can see, okay, medical social sciences, I just showed you that massive list. These are the courses that are actually being offered. So when you go to the schedule of classes, you can just search by these codes. Which hopefully is helpful. Another resource I want to mention from the Global Health website, because I know a lot of you mentioned being pre-med, and some trying to graduate in 3 years. So we do have some sample plans here, as well as AP transfer coursework. But down here is our pre-med kind of sample plans. And so if you are a BS global health major, this would be a sample 3-year plan. So you can be a global health major and pre-med. Everything listed in black are global health major requirements. The blue are also global health major requirements. Those are the upper division biological science electives. So those are the courses that I say to be strategic about, like pick biological science electives that will also count as pre-med prereqs, right? What's listed in green are the courses that are not required for global health, but that are pre-med prereqs. So the physics sequence and OChem sequence. So there's still a way to fit it in and graduate on time and be a global health major. Right? And I will again be sharing all of those links out after the session. Oh, one other thing I wanted to mention about pre-med. So there will, on September 23rd, the Career Center will be hosting several pre-health, pre-med orientations. So as soon as the space and time has been assigned for those, I will send that out, but just keep that in mind. I went last year and it was, I thought, really, really helpful orientation. All right, and now if I can find my cursor, too many things. Okay. I want to share some kind of samples for you. So with the degree audit, so you'll have access to this in the fall quarter. This will list everything that you need specifically for your global health major requirements, your college requirements, and the university requirements. So again, this is where looking at the Global Health website, also with the degree audit is super helpful when planning, because you can see here it just lists out the course codes, right? And then I have a sample of the academic history. Academic history will list what either AP credit or transfer credit you're coming in with, and then what credit you're going to be getting at UC San Diego for that. Another kind of hot topic right now as you prepare to enroll are your booking times. So you will be getting notices from the registrar's office once your booking times are available. And the UC San Diego does a unique kind of like enrollment system. So you'll hear about a first pass. So that's when students can enroll in up to 11.5 units, but you cannot waitlist. So this ends up being most of the time that student enrolls in 2 courses. Then there's a second pass, and then you can enroll in up to 19.5 units, and that's when you can start waitlisting for courses. So in general, I advise in the first pass, be strategic. If there's, especially some of those like STEM courses tend to fill up very fast. Sometimes college GEs fill up very fast. So if you are looking to do like math or chemistry, I would usually go for those in a first pass. If you don't get in the first pass, then you waitlist it in the second pass, right? Always use your first pass, even if the classes you're really wanting, if they're full in the first pass, still enroll, right? And then let's see, after the second pass, once the quarter starts, then students can enroll in even or waitlist in even more units, up to 22 units. How I advise is generally not to take more than 4 classes ever. 12 units is full time. Students often need to take more just for financial aid purposes, so usually take about 16 units. But I want you to sleep. I want you to see your friends. I want you to get involved. And so that's why I always kind of stick with 16 units. Around 16 units is plenty, and you'll still graduate on time, if not early. I lost my cursor again. Okay. So the field experience, this is unique to the global health program. So for both the BA and the BS majors, there's a 100-hour like experiential learning requirement. So students can fulfill this with research or clinical shadowing, internships, studying abroad, volunteering. There you can use up to 3 different opportunities to fulfill this field experience. It can be domestic or international. It can be credit bearing or non-credit bearing, so like volunteering, and it can be paid or unpaid. My general recommendation is to start thinking about this early. So for incoming transfers, I would say maybe winter quarter, start thinking about it. Potentially, I've been seeing more and more students working on it over the summer, which is great, especially if you are involved in a lot, plus all your classes and everything. So don't worry about it this first fall quarter. There'll be enough going on, but do start to think about it early on, especially if it's something you want to apply to, so that you have that time to actually enjoy the experience and get a lot out of it. For incoming first years, I would say maybe start thinking about it over your next summer, or your second year would be a great time to get going with it. But just start to look at our pre-approved opportunities, and then hopefully those will spark some ideas of what maybe you're interested in trying, and then our student panelists will speak to some of that too. Let's see. So in terms of the field experience kind of whole process, so it starts with finding a pre-approved field experience. So we have lists on our website. If you are wanting, a lot of our pre-approved opportunities are in San Diego County. If you are looking to do an opportunity, for example, in the summer, like in the Bay Area or something, and there's a hospital you want to volunteer at, you could submit a pre-approval request. So I would get that forwarded on to the Global Health Faculty Director. He would review that, and then I would follow up with you in the Virtual Advising Center if that was approved or denied. So as long as it's approved, then you would just begin your hours and start tracking them. Once you have completed your hours, you could either use a field log, which is accessible on our Global Health website, or have like a volunteer coordinator email me to verify your hours. When I have when I have like that you have all the 100 hours completed, that's when I'll update your degree audit showing that you have completed the field experience requirement. Right. And for today, I think I am going to maybe, if there's time at the end, then I'll go over the field experience pre-approved lists more. But I think for now, just to make sure that we have time for the panelists and questions, I'm gonna hold off on that. And then to my panelists, could I have you maybe turn on your cameras if you're comfortable and let's see. Trying to see people. Yay. Okay. And then I'll have you introduce yourself. So your name, BA or BS, if you have a minor, what student orgs you're involved in, what you're doing for field experience, and then one thing maybe you wish you'd known when you'd started here. It doesn't have to be global health related. And then once you've kind of done an intro, then we'll open it up to questions. All right. So let's see, from the order I'm seeing it, Richa, I'll start with you, okay?
Okay. Hi everyone. It's nice to meet you guys. First of all, congratulations. I remember the year I was applying, it was like already super hard to get in. So I can imagine how much harder it was for you guys. So you should be really proud of yourselves. I am an incoming senior and I'm doing a BA in global health. I started off, as Jane knows, I started off with BS, then jumped to BS again, and then now I'm very much set on the BA. But you'll find that like your interests might change during college. And yeah, and for my field experience, so the UC School of Medicine has a program called Healthcare Frontiers in Tijuana. And so that's what I did my sophomore year. And that covered 50 hours. I still have my 50 hours left, so I have to complete that this year. But that was super interesting, very unique. We went down to Tijuana every other Saturday. So that's 4 Saturdays of 1 quarter. And you're shadowing a doctor, you're interacting with patients. Even if you don't know Spanish, I think it's still a great experience. You're gonna like be networking, you're gonna be meeting a lot of people, finding out what you like to do, what you maybe don't like to do for career. Yeah, so that's field experience. And then what was I involved in? Yeah, so actually Anuva, who's also gonna introduce herself later, we're both part of a club called Global Health Talks. I can put the Instagram in after I'm done speaking, but if any of you guys are interested in checking that out. But that's more focused on like community networking. You'll find there's another club called Students for Global Health. That's more like volunteer based and kind of also student community. But we're new, we just started in January. So yeah, if you guys are interested, I'll put the Instagram in, you guys can check that out. Yeah, and then the other stuff I'm involved in is more like outside stuff, so probably not as relevant to UCSD, but I'm always happy to talk about that too another time. And then what I wish I would have known. So the global program here is pretty small because it's fairly new, but you'll find that because it's small, sometimes the classes you'll take either with like Professor Sanchez, right? If you take like Global Health 20 this incoming fall quarter, or other classes too, they're all like global health majors and you'll have like smaller classes. So really take advantage of that and, you know, talk to other students, like meet people who may not have like the same interests as you. I would also recommend, if you can, a lot of the upper division global health classes let incoming freshmen take that, or even like if you think about like your classes for next year. And those are smaller classes, so it's always like nice to take those smaller classes earlier on, because those are also more in depth and more detailed than your introductory global health classes. So if you could do that, I think that would be really great. Yeah, I came in wanting to be a registered dietitian, and then I changed to research, and then I changed to pre-med, and then now I'm pre-health, and I don't know what I want to do. So yeah, it's like just explore your interests. Like, don't be afraid to talk to professors, talk to upperclassmen, and also join clubs that like are also like not related to your career path, what you're interested in. You never know what you're gonna like. So yeah, that's a little bit about me. But yeah, it's great to meet everyone and happy to answer any questions later on.
Thank you. And now go to Anuba.
Hi, I'm Anuba. I'm going to be a fourth year, and I'm also a global health major with a biology minor. And I want to mention that I came in as actually a biological anthropology major. So while I kind of had like, I feel like an idea of what global health was, it wasn't before I took a few classes and I was like, wait, like I'm really enjoying this and like I want to do more here. And I feel like a lot of the professors I've had the opportunity to really be in their classes for, they have a bunch of wonderful experiences that like definitely do not be afraid to like talk to them because like Richa mentioned, um, even I feel like the intro classes, they're gonna be a lot smaller than like your general ed and the bigger like biochem, maybe even math classes that you might have to take. But yeah, I think so far, like I feel like the community of people that I've been able to meet has been so like satisfying, and I added on my bio minor like I would probably say like last year. And so as a junior, I kind like knew that I wanted to be in the medical field. And so when I came in as a freshman, I was still like, more broadly pre-health, but um, I feel like global health itself like helped me like consider a bunch of different pathways I could take. And so my field experience actually helped a lot with that. This was also Health Frontiers in Tijuana that I did mostly like at the beginning of last year and the end of my sophomore year. So, like I want to add that not only do you get to like observe doctors from the UCSD med school and like um I think like medical students as well, but you'll also get to meet medical students and doctors from like I think UABC, which is the like Mexico like Tijuana located college as well. So I think that's a great opportunity to like really get an understanding of what like global health is in such an immersive environment and get to like learn a lot, even if you're just like seeing it. I feel like you don't feel removed from what is actually going on. So I enjoyed that, and I think there was a research element involved as well. So, like, if that's something you're curious to learn about, I would be excited to discuss it with you. So please reach out with questions. But if I were an incoming student, I think not like this isn't global health specific, but I wish I had known like really how to go about making all the information that is available like about the program, the major, the colleges, all these opportunities, like how to really make them like for like myself. And by that I mean really kind of like learning by putting myself out there more, really like experiencing it and like gathering from that because there's really like so much like you can tell from like even me just like telling you. So I definitely want to encourage you to like come out and like show out to like the variety of things that are like available. And Global Health Talks is a great community. And I would say like even though it's like relatively new. There's such a variety of like global health majors there that have interest in things like pre-law, like pre-research. So definitely like getting the opportunity to talk or like even if you're not set on something, or if you are, just hearing a different perspective can even like clarify something for you. And like that's really what global health has primarily been about for me. So, um, outside of like academics, I'm involved in clinical research, and I understand what like securing this kind of like thing can be like. Like I did like cold emailing. So if any of you guys do like plan to seek out any research opportunities, and if you need help with that or any form of guidance, like I'm happy to answer questions with that, or just talk a bit more about what I did and what helped me get that kind of experience. And then I am going to be the president of Students for Global Health next year. So I want to say that we like want to like know about like hear about you guys and like what your interests are. So what you care about is really what we can design our activities around to like support you in that way and move you closer to your goals. So this will be through like socials, fundraisers, study jams, and um also like we want to like volunteer or like as a group in these pre-approved field experiences that I think there's like a list of them on the global health like program site. So that's like a great place to just, sort out what or like look at what pops out, and um even like let us know, and like we'll help like accumulate these hours together. So um, that's definitely something to get excited about. We want to connect students to faculty, global health research opportunities, and this will also be a space for discussing classes, like what you might need help with, what we can help you like see more of. And yeah, just navigating global health in general, but really like an informal space. So like really just want to encourage that everyone like is like is comfortable to speak out about what they want to do, and like how we can ultimately like bring you closer to that. So yeah, if there's any more questions, like I'll answer that in a bit after Anderson.
Thanks, Nuba. Yeah, Anderson.
Hello, everyone. My name is Anderson. I actually just finished my first year here at UCSD as a global health, so I'm an incoming second year. I am a BS major, and I am on the pre-med track. Again, congratulations to all those who got accepted this year. I know you guys will have a great year. So a little bit of what I'm involved in. Um, I'm a little more like gung-ho on my activities. So I do outside research on outside literature review research on cannabis, on substance use, and its effects on diverse populations. I also do epigenetic research on the process of aging as well. A big club that I suggest joining that I am a part of is called the International Health Collective. It is a nonprofit organization, student-led organization that works to provide holistic and culturally sensitive and sustainable care to the communities in the San Diego, Tijuana region. I am a project manager for a project within the club called Vision Care, where I'm in charge of um, planning and implementing different vision care initiatives like eye care education materials, um, vision acuity tests, and outreaching to different optometrists to provide um, care to the patients that we serve in the clinics we have in Tijuana. There's also another um, there's also another club called Flying Samaritans. So these two clubs are very hands-on. So if you're looking for hands-on volunteering opportunities, I highly suggest looking into that. They are clubs with interview processes and application processes. So heads up, clubs here do have that. So it would be best to prepare a little bit, but that's not meant to stress at all. That's not meant to really worry you at all. I thought you guys are all capable since you guys are here in the first place. My field experience is a little limited because I just finished my first year, but I am planning on fulfilling it through my research and my volunteering opportunities. And as well, I plan on um, going abroad to Vietnam as well, doing international work in hospitals there. Um, Last year, something I wish I had known, something I wish I had known is how important it is to have those interpersonal, like soft skills when wanting to kind of put yourself out there. But that's something I know a lot of you might have questions for. How do I put myself out there? How do I network? How do I reach out? How do I connect? And that all stemmed from really taking the initiative and putting yourself, while although maybe uncomfortable, just kind of as being open and just being yourself to anyone you meet. Because a lot of the opportunities that you'll get will be random. It will come out of the blue, but it'll come just from talking from people older than you, people in sophomore, juniors. My opportunities that I got all my opportunities because I happened to I got to know upperclassmen, and then they were the ones who kind of gave me information and other opportunities on what they were doing and how they could help me and on how I can approach my activities as well. So if you wanted to ask me some more questions about research or different volunteering opportunities, or just more so about the skills that are necessary that are not like that you don't see taught like in curriculum, but more so like something that you have to learn or experience on your own, then feel free to let me know. I'll send links to the two orgs as well. Thank you.
Awesome. Thank you all for being here. And now we'll open it up. So Ava, you've been patient and had your hand raised. So if you want to unmute, you can, or put your question in the chat. Or anyone else, we'll just open it up. All people. Oh no. All good, Ava. All good. Okay. I'm going to share some of the pre-approved field experience opportunities and then just, oh, great question. Okay. And this one was for Anderson. So how were you able to get into research as a first year? Awesome question.
Research at first started out like the main approach was you might all like, just like kind of um, not like at first is cold emailing at first, because research takes like trying to get into labs and actually doing something takes a really long time. So if you know for sure that you want to pursue like a pre-med pathway and research is something that you're potentially interested in, at first you should definitely look into all the different faculty labs that are interested in what you want to, or that you're curious about. Like if you're interested in cardiovascular labs or any other thing that you're interested in. It first starts with cold emailing at first. It's it's a long process, but it was in combination of meeting someone in a club who was in a lab. Basically, I was able to cold email on their referral, and so when you have a referral, it's easier for a PI or whatnot physician to respond to you, knowing that someone referred you to them, and so because you were referred, you have some sort of credibility as a student, and it's kind of easier to get introduced that way. And it really helps to be really kind of specific on how how you kind of know what you want as well. So I hope that kind of answered. It is different for everyone as well, but you will have the opportunity as long as you put yourself out there. You will make the effort. You will get it. So
Thanks, Anderson. And the next question I see is a transfer student asking about if they took a Intro to Global Health course at their community college, how to use that for their major requirements. So there are two parts to that question. So one is to check on assist.org to see if it already has an articulation to count for like Global Health 20. If it does not, then I would have you do a Global Health petition in general for incoming transfer students in particular. If I haven't already met with you, I do encourage you to email me to schedule an appointment because you're all coming in with different credit. And so to work through assist.org and see kind of what classes you should be taking in the first quarter. I am happy to meet with you via Zoom or in person. So please reach out if you have questions about what to do in this first quarter, especially while your transfer credit is still being posted. The next question I see is in the application or TSS, does it say if you are a BA or BS? My understanding is that most of you were admitted for BS. So that was kind of the default. Once the degree audits are up, then it will say on there explicitly BA or BS, but with the TSS, I'm trying to think of where it would be listed. I might have to come, I will follow up in my, if I can, I'll look around to see, unless any of my student panelists can tell me where they are seeing it in TSS of if you're BA or BS. But it might be different for incoming. So I'll include that in my follow-up email. All right. And next question, is it harder for transfer students to find ways to get involved? I actually might speak to this one a little bit. I think I don't think it's necessarily harder. I think it's just that you have a shorter time here. And so like with field experience where incoming first years just have more time to kind of, try out different opportunities. That's where I encourage, incoming transfer students to get going kind of right away or sooner, just to start looking at those. Like, for example, with HFIT that our panelists were talking about, that's one that sometimes students, because it is by application, sometimes it takes several quarters of applying before getting in. So if that was a program you're interested in, I would say potentially start once you've taken like Global Health 20. So whether that's in the fall or maybe winter, that then you would start applying so that then you have a chance to get involved. I think in the fall quarter, really taking the time to go to get involved with student orgs, as all of our panelists have said, like kind of put yourself out there, as uncomfortable or awkward as it feels. Know that everybody else was there at some point, or is feeling the same way. And really, people are there to support each other. So I would say that that's really the kind of the best way to get involved. And then if you're struggling with how to get involved too, you can always reach out to me or your college advisors too. And I can also connect you with some of the Global Health transfer students too. I see a question about junior, like a transfer junior, if it would be too late to study abroad. No, not too late, not too late. I do tend to see most students studying abroad in their fall quarter, because with studying abroad, so often it is like on semester systems. So just, especially with transfers, that you have your 6 quarters. So we don't want to take out 2 of those necessarily with doing a semester long program in over winter and spring quarter. So I would say, potentially to look at or start thinking about maybe fall of your senior year. And then in terms of global health, major requirements you could take abroad. With the global health program, it is very doable to study abroad. And so generally I see students taking upper division biological sciences or medical social science electives when they're abroad, because those are the elective categories and have so many different courses that can fulfill those requirements. But when it comes to study abroad too, even though I typically do a workshop in the fall with study abroad, again, that's a great time to come in to meet for an appointment to talk more about it. And then I see a hand raised, so I'll jump to you.
Hi, I just wanted to ask, like, I know, like, it might be a dumb question, but in regards to like pre-med or just in general, like, I don't really understand what's the difference between public health and global health. Like, if you could explain that better, that would be really great.
Sure. Yeah, definitely. So with the two majors at UC San Diego are actually very different. So with global health, you'll see that the curriculum is interdisciplinary. You're going to tailor it towards what you're interested in. And we have the field experience requirement. With public health, students are taking more of the courses in the public health department. So fewer elective options, fewer options outside of public health. And there is a little bit more research focus in the public health program than the experiential kind of learning with global health. In general, though, I will say that students can get to the same career goals with either major, right? Even with students who are like pre-health, pre-med, what I hear again and again is it doesn't matter as much what your major is, it's that you're meeting those like prerequisite courses and that you're getting all of the other experience or clinical hours outside of the classroom. So I hope that helps a little bit speak to the difference in the programs.
Yes, thank you so much.
Oh yeah, of course. Oh, okay, Anuba. Sorry, I'm just going through the chats. A question about the 3 bio classes for the BS major, and kind of which order to take them. So for lower division, there's build 1, 2, and 3. This is a great question. Students can actually take build 1 or build 3 first. Build 2 as a prerequisite of build 1. So in your first quarter, I feel like a lot of students like naturally go right for build 1 and it fills up, and then there'll be all these seats open in build 3. So build 3 is a great option that you can take too. And then for the upper division requirement for the biological science electives, again, you would just be selecting from any of the courses that were approved, but with upper division bio courses, there are going to be prerequisites. So just making sure that you are meeting the prerequisites to take those courses. And then, yeah, I don't know if any of our students have anything, panelists have anything else to add to that. I got it. I'm going to keep going. Let's see. There's a question about, is it possible to finish global health in 3 years for pre-med or pre-health? Yes, I have seen it done. I will say I haven't seen it. It's doable. I haven't seen students then get as maybe involved in some other things or add, like students that have done global health, a BS in global health as pre-med, haven't added like a double major or a minor. So, but it also kind of depends on which college you're a part of, honestly. So some of the colleges have a lot more requirements, as you'll start to hear, than other ones. So which ones it is more doable. Another thing to I don't know, kind of highlight too. A lot of students, I think, come in thinking you can only graduate at the end of every year. But really it's whenever you're done with all of your major college university requirements. So we have students graduating at the end of every quarter, at the end of summer too. So even incoming transfer, if you're concerned that you don't have a lot of transfer credit that would potentially work towards your global health major requirements. If you extend to the, a following summer, you can graduate then, even if it goes to next fall. So you can graduate at any time. It doesn't mean you're necessarily like have to end at the end of like 3 years. It could be or 2 years or whatever it is. Let's see, students asking about the HFIT program. I had in a note here, I will send in my follow-up email to you all the link to more about the program and then the application too. Typically the application opens when the schedule of classes is available for the next quarter. So again, that's something that I highlight in the newsletters, but I can share more about the program in my email. And then do you, Richa and Anuba, do you want to share anything else about your experience with the application process? I can say one other thing maybe on the administrative side before I hand it over to you two. The students typically find out if they've been accepted into that program like right before the start of the quarter. So in terms of kind of planning, I always recommend don't plan on that course, like plan a different medical social science elective or a different course. And then if you get into the class, then you can change your schedule around. You'll get an email from me that you've been cleared, and then you can kind of switch your enrollment around. But just because students find out kind of so late, I don't ever want a student to be waiting on hearing if they'll be accepted to that course. Question about academic history in TSS. Hot topic. There isn't an exact date. So that's still being worked on. For those of you that are coming in with potentially a lot of AP credit, and if you're unsure of really how that'll work in terms of what you take in the fall quarter, I would say either send me a message in Nutrient Advising or email me to schedule a Zoom and we can chat about it too. So, and I'm happy to look at assist. Oh, Andrew's answered something. Okay. All right. Sorry, just going. Did I miss anything? Am I missing? I think I started to go through. Does anybody have any other questions? Otherwise, we're right at 4 o'clock. So I'm happy to hang out for another couple minutes, but I want to be respectful of your time too. And so if you need to go, thank you for being here. Welcome to the Global Health Program. I look forward to working with you. But yeah, I'm happy to hang out too if people have additional questions.
And thank you, everyone. I hope to see you in my classes.